Hello, everyone, and welcome to another episode of the Pre-Health Purple Hawk podcast, hosted by yours truly, Chris Orzak. I'm pleased to introduce our next guest today, who is an alum of Hunter College, as well as New York Institute of Technology, College of Osteopathic Medicine. So we have a DO today, and he's a current resident at NYU's Anesthesiology program. So welcome, please, Dr. Simon Katz.
Thanks. Happy to be here. Thank you for having me.
Absolutely. It's a pleasure. It's my pleasure. So, I like to kind of start these off opening the floor for you to talk about, what made you go down the route, the path towards medicine. And you can kind of take it as far as you want, the journey sort of. So yeah, I'll let you answer that.
Sure. So it's actually a question that I've thought about a lot, over the years as to why I'm kind of doing what I'm doing. I was a public school student my entire life, went no private schools or anything like that. Went to obviously a public CUNY at Hunter. Didn't really know what I wanted to do kind of entering, but I entered as pre-med. My parents definitely would have loved for me to become a doctor, as there are tons and tons of, students out there that have parents that would love, for their kid to go to medical school. So I just kind of went in by default, like, I was pre-med, but I didn't really know, what I wanted to do. I didn't really know what being a doctor was like. Um, I just kind of, entered in as default. Um, Fast forward to my sophomore year, I'm sitting in Hunter College's biology lecture, and I'm sure any student that watches this, they know kind of the struggles of Hunter Bio. It's definitely a tough course, but anyway, I'm sitting there and we're getting a lecture about the kidney. And during that lecture, we were talking about kind of how things like drinking a beer or having a coffee kind of affects the nephron and like how much you go to the bathroom, right? That was the first time in my entire really life in general where some type of science finally kind of like related to just my everyday life, right? Like plenty of people have a coffee, plenty of people drink alcohol, right? And so I'm like, huh, so that's why, I every time I have a nice coffee from Starbucks, like kind of an hour later, I'm, rushing to the restroom. So that was super interesting to me. I loved it. I still remember that day. I went to the library. We had an exam coming up, and I was just studying that chapter in our textbook for so long, just out of pure interest. And I fell in love with kind of understanding the body. I thought it was super interesting. And that's when I was like, you know what? I really enjoy learning about this stuff. So I decided, yeah, I think I'd love to go to medical school over kind of any other real, like PA versus go the NP route or things like that. Really, because I said to myself, I'd love to be in charge of like a patient's care. Um, you know, we can probably talk about later how there are plenty of other ways that you can be in charge of a patient's care and contribute for sure. But that's what I thought initially when I was 19 or something like that. So yeah, decided to go to medical school. Ended up going to NYIT Com or NICOM as I call it out in Long Island, and then now having a bunch of fun doing some anesthesia here at NYU in the city. So
Yeah, I think a lot of people would relate to the moment you discussed where you felt like something really related to the material that you were or rather that the material you were learning related to something like deeply interesting to you.
yeah.
um it's kind of hard, biology is it's easier, but it's kind of hard overall to like always kind of see how what we're learning as pre-meds, in our undergrad years is relevant to our futures in medicine, right, ideally. But it's actually, as everyone kind of finds out over time, I think that it's actually there is a lot of connection. And especially in classes like biology, I have to say, I just graduated recently. Biology became my favorite subject. And I was always kind of interested in it, but again, it's like it's that science that connects the most, to the actual physiology in terms of medicine. And yeah. So, actually, speaking of anesthesiology, I'm wondering, at what point did you kind of start leaning towards that for your future specialty? Did that happen earlier on, or was it something in med school that
Yeah. Yeah, so good question. That happened way later on, actually. Most of medical school, I wanted to be a surgeon. I wanted to go into orthopedic surgery. And really, what was the kicker for me, and I advise this to pre-meds everywhere, that are listening. Medicine is a great field, and it will, leave you very fulfilled in pretty much anything that you do. You're helping people. Um, but at the end of the day, it is not it can be a very anti-lifestyle profession. Um, a lot of times, your own lifestyle, even sometimes your own like health is put, at the wayside of your job. And I think surgery can be, and that is, but can be one of those specialties, especially during residency. I see a lot of surgical residents that are working close to 80 hours a week. And just coming in super early, leaving super late. It's tough. It's tough. And you can only really do that if that's truly the only thing that you see yourself doing. And when I was an early med student, when I was a pre-med even, I was like, well, yeah, orthopedic surgery is the only thing that I see myself doing. But then you have to ask yourself, well, why? Like the reason I made the change was, well, why? Why is it the only thing that I see myself doing? Because when we're so, us as pre-meds, right, we're super, super determined and ambitious, and we have our eyes set on a goal, and it's hard to kind of get us swayed off of that goal. But you have to ask yourself, why? Why do I want to do this and only this? And it came down to, well, I really like to be in the OR. Financially, it really makes sense. You get reimbursed really, really well, and that's something that I wanted to accomplish. But that was, that ended up really being pretty much it. I mean, I liked kind of the mechanics of the body, and I thought that was pretty interesting. But I realized way later on in med school that that's really the only reason why I wanted to do it. And that would leave me super miserable, especially during residency where you're working a lot of hours. If the only reason you're chasing this goal is for stuff that other fields can provide at a much better return for your own, lifestyle. And so naturally, a lot of surgeons end up seeing anesthesia behind the drapes. And, naturally during the case, us as anesthesiologists, we're just kind of hanging out, or, ideally, if the case is all going well, we're kind of just hanging out, making sure our patients are doing fine. And so I saw that and I said, well, that's pretty interesting. I'd love to see what that field is like. And so I kind of made the transition to anesthesia, ended up really, really liking it. It kind of gives you everything that you would want out of surgery, those baseline qualities that you talk about. But it doesn't give you such a gritty lifestyle. And again, I can't speak to, attending life. There are some attending surgeons that have a great lifestyle, and they are, not working a lot, but, we're still seeing the amount of patients that they want to see, et cetera, et cetera. But during residency, it can get very tough. So long story short, I made the transition from surgery to anesthesia pretty late. And it was because I wanted to be in the OR. I still wanted to do some procedures. And it's still pretty intensive work. Surgery, when you think surgery, you're thinking like, someone's spleen just ruptured, rush them to the OR, like you got to save their life. Anesthesia is actually doing the same exact thing. When there's a big trauma, right? Again, most people think that we just kind of hang out behind the drapes, but when there's a big trauma, for example, that is like all hands on deck. Like things need to happen in a matter of seconds to minutes. It's like urgent. And so you still get that great adrenaline rush, but it's kind of buffered by, the standard, cases that are, pretty cruise like. So though for all those reasons, I fell in love with anesthesia. Super happy I made that decision. Because it kind of gives you back some control over your life, but still kind of gives you that fun in medicine that a lot of intensive care like specialties give you.
That's really interesting. I wonder because you mentioned that it was pretty late when you made the switch. Do you mind? I'm not sure if I missed it, but when exactly was the decision made? Like what point were you at?
My fourth year of medical school. Yeah, my
So
fourth year
right
of medical
before
school.
you were applying to residencies,
Yeah,
or
yeah,
I
yeah,
see, I see.
exactly.
Yeah,
Mhm.
I find it interesting just because people often ask me, usually people that are like not in the pre-med world or whatever, they want to know what kind of doctor I want to be. And for me, it's like I feel comfortable saying that I don't know because it's like there's so many different things that are interesting in medicine. As you
Mhm.
pointed out, like there's just like it's all medicine at the end of the day. There's that unifying factor where at the end of the day you're treating a patient, and that's like the thing that I think attracts people to want to be doctors the most. But then there's a lot of different ways you could do that. And I think some people, they get anxious about it, like they're pre-med, or maybe they're even in med school, but in this case I guess we're talking mostly to the pre-meds. um they might be worried or something about what to pick. But as anyone who's watching can see, like sometimes you figure it out later down the line. You definitely don't need to know that stuff before med school. And I think students should like not worry too much about that as long as they care about that core unifying factor about helping people. I think that's what should push them forward. So I just felt like that should be emphasized because I myself am not sure, and it's a
Yeah.
long road. So
Yeah. And it really comes down to kind of what you like to do in your day to day. If you like to work with your hand, like you love working with your hands and you're okay for standing for a couple of hours and not leave, you
right.
literally cannot leave until the job is done, then, maybe you'll really like surgery. If you like working with cool technology, right? Pathology is a great field, right? If you're interested in mental health, psych is an awesome option. If you are interested in kind of pictures and how, topography can help you make a diagnosis of a stroke or a bleed or something like that. And you're okay not exactly speaking to patients directly, but helping teams make that decision. Radiology is awesome. So it really, really, it can be a basic question that can be hard to answer. And you still, people in med school right now still don't know what they want to do. So, but there's a lot of basic questions that you just have to ask yourself, and you'll eventually get to the right decision.
In medical school, I know that in the third and fourth years, med students will do, I think it's called internships. Am I using the right word?
So it's clerkships, like clerkships.
Clerkships. Yeah,
Yeah.
that's kind of what yeah. And I was just wondering how many different specialties were you exposed to during that time?
Ooh, a lot. So I think it was, I want to say like 7 to 8.
Okay.
Um, because the rotations are
Do you get to
about
choose
a.
them or?
So there are certain core rotations that you have to do. You have to do
Okay.
like OBGYN, you have to do surgery, you have to do family medicine. And then, I forget the other core ones, but then you can sprinkle in some electives as well. So it
That's
comes
cool.
out to around 7 to 8. It really depends on the medical school that you go to. They all have different kind of structures as to what rotations you do. But you do a lot of the basic ones. Like I said, OB, surgery, then you go to, the clinical setting, family medicine, internal medicine. You have to do that as well because really what you learn as you go throughout medical school is that surgery and internal medicine, they are like the forefathers of medicine. 1,000 years ago, every single doctor was either a surgeon or an internal medicine doctor. Maybe not 1,000. 500 years ago, every doctor was either a surgeon or an internal medicine doctor. There was no in between. 1,000 years ago, every single doctor was both a surgeon and an internal medicine doctor. And as the years kind of went on, all of these little specialties started to come about because one person said, "Hey, I'm really, really good at, doing a C-section. Hey, I'm really, really good at removing a thyroid. Hey, I'm really, really good at, removing tonsils." And that's how ENT came to be. I'm really, really good at fixing a broken wrist. So you have to do the core ones, which is, surgery, internal medicine, OBGYN is a core one, family medicine is a core one. And it comes down to around 7 to 8. Psych is another core one. Psych was an interesting one. And yeah, I think that's pretty much the basic core ones. I ended up doing 7 to 8, I believe. So,
You intrigued me there at the end when you said psych was an interesting one. I feel like maybe there's some nugget of storytelling or something there. Do you
yeah,
want to
yeah,
elaborate?
yeah, sure. So, I did my psych rotation. I did it at an inpatient hospital unit. And so I still
Maybe
remember.
explain what that means for viewers that don't
Sure.
know. Yeah.
Sure. So there's outpatient psych, some people that come and get treated for, anxiety or, some depression, things like that. Then there's inpatient psych. That's people that are like schizophrenic, really bad schizophrenia, and are like a harm to themselves and others, right? Bipolar, really bad bipolar, are a harm to themselves and others. Um, just things like reasons why people would be in inpatient psych is, like I said, if they're a harm to themselves or they're a harm to others, that's when you have to essentially restrict their rights and keep them in the unit. That's basically what inpatient psych is. And so I was doing I still remember this to this day. I was a third year medical student, and I'm going up to, going to the inpatient unit, which is like a little alcove of outside of the hospital. So it's not like, on the regular floors where you go see someone that, their tummy aches or something like that. It's a completely separate unit for obvious reasons, right? So I remember I'm walking into this like building that's pretty much on the side of the hospital, and I find the elevator. I get into the elevator, I hit door, floor 3. That's where I was told to go. I go up there, the elevator door slides open, and I'm immediately met with like a cage door right outside of this elevator unit. And right behind the cage door, there's just a patient in a yellow gown in socks, just walking so very, very slowly, not moving his arms at all. Just like walking very, very, like very, very creepy. Like this is my very first day. So I'm like, whoa, like what is going on? First of all, I can't even get out of the elevator. I don't have a key to get open this cage door. And there's just this patient, walking. I don't know who this guy is. I don't know what's going on. They're all so later I learned that these patients are free to roam the floors for their own psychiatric help. But in the moment, I'm like, what in the world am I supposed to do? So I start, kind of rattling the cage door. I'm like, hello, can anybody let me in? And there was a clerk nearby that kind of opened the door for me. Um, then I obviously got more comfortable with patients just, walking the regular floors, because on a regular medicine floor, surgery floor, any floor in the hospital, you're not allowed to just walk aimlessly usually like that. Right. So it was super unusual for me. And that was the biggest, like, jolt of adrenaline in that moment. Throughout that month, saw a lot of cool stuff, saw some really sick patients. Unfortunately, think people that had a really bad bipolar or schizophrenia, and just looked generally like, mentally unwell, unfortunately. Um, and during that rotation, that's when I learned I didn't want to do psych. And the reason why is because at least inpatient psych, I think now as I have progressed through my medicine, I think outpatient psych sounds like a really great option. But at least inpatient psych, I don't know how much I liked it. Simply because patients don't really like you as their psychiatrist, I found, because you are the one that's taking away their rights and they don't fully understand why you're doing that. So to them, you're just their gatekeeper. And so you're met with a ton of anger and, a ton of depression. And that's not something that I really wanted to, do or deal with in my day to day. I had noticed that the physician that I was working with, he was very, super detached to like this anger and bad emotions coming at him. He's just like completely tuned it out at this point. And to me, that kind of signals someone that has just dealt with it for so long, they're just over it. And I just didn't really want to deal with something like that. And so during that rotation, I made the decision that I didn't really like psych. So that's kind of my psych story. We'll definitely never forget that first, elevator ride up and that seeing that cage door with the patient walking back and forth. So that's
Yeah, it
story.
must have been. It must. It was a weird environment, right, to be suddenly thrown into, totally unprepared for like
So
you.
unprepared.
They didn't even tell you that like patients are allowed to walk around, so you see
Nope.
that, and it's like that's alarming because
Yeah.
I am not aware that this is, that. Yeah, that's it's funny. And regarding like the job itself, yeah, it's inpatient psychiatry, especially as you said, yeah, it is tough, and I think it takes a special kind of person to someone who is willing to like I don't know somehow I don't know if it's get used to like you said or just kind of
I would say maintain humanity. It's hard to
yeah,
maintain humanity.
exactly, yes,
It's
yes.
tough.
I yeah, like because you can't really blame someone for having a mental disorder. I mean, it's like you have to kind of then treat them like they they just are that way, unfortunately. And they're not gonna just be the way you want them to be, because they're not capable in some cases
Yeah.
of meeting our expectations, I guess you could even say.
Yeah.
So but yeah, it's a tough job. I've definitely heard that before. And it's interesting to me, though, like you said, like the psychiatric field in general.
Mm.
Oh, outpatient psych as well.
Yeah.
um
Has made the field of psych actually super competitive now, especially after
oh,
COVID,
really?
because a lot of these
Oh, yeah, yeah,
a
during
lot
COVID.
a lot of like video meetings are being done by
Yeah.
psychiatrists now. And so that, kind of causes the lifestyle aspect of that field to really elevate. And so that makes it super appealing to applicants.
And
And so yeah.
also, oh, sorry, I didn't want to cut you off.
No, no, that was my thought, is that, the video chatting aspect that kind of I feel COVID really introduced and made mainstream and made really normal life.
I mean, here we are,
As
right?
exactly, yeah.
on
I
a
was just gonna say,
Zoom
here we are.
podcast.
Like that has really
Yeah.
elevated the field of psych in terms of its competitiveness. Yeah.
Yeah, and I thought you were going to go in this direction, but also I'm pretty sure it's like agreed upon at this point that during the pandemic there was also a lot of like rise of things like anxiety, depression, etc.
Oh yeah.
Whether because people were isolated, or because they just had so much time to be alone and started like uh thinking and coming to the realization, or whatever, that they had one thing or another going on. I think, yeah, a lot has changed, yeah, since that era. A lot of
Oh, for
things.
sure. Oh,
I
it has revolutionized so much, so much.
And speaking of the pandemic, maybe, yeah, I was gonna ask whether or not how your experience may or may not have been impacted by the pandemic. I suppose you must have been early med school years, right? Back
Yeah.
then. Is
Yeah.
there still, so why don't I'll ask this to make it like more cohesive. You could tell us about how, your experience was impacted, and in your later years, I suppose that would have already been after, because what year are you in residency?
I'm a PGY3.
Oh, okay. So when you graduated med school, was it during COVID?
When I graduated med school, COVID had already started to basically come to a close.
Okay, because I was gonna ask, how did it affect med school, like
Sure.
curriculum and stuff like that, and whether and what like is still impacted by that. Like,
Yeah.
for at Hunter, for example, we started doing a lot of virtual classes, and now there's still a lot of virtual classes, or virtual options, or virtual materials, etc. So that's kind of I don't know if that makes sense what I'm trying to ask, but
Sure. Yeah, no, it makes sense. So I'll tell you kind of how my COVID experience went and the height of the pandemic, and then how I feel it's changed hospital life and how I feel it's changed the
oh,
medical
yeah,
school as
that'd be
well.
good. Yeah.
Yeah, so when COVID first hit, like, and the country basically came out and said, like, listen, we're locking everything down. I was a second year medical student, and this was like March or maybe early February 2020. I was like in the peak, like all engines go on step one studying, which is like back in my day, step one was still graded, and it was a
Hmm.
huge exam for us. So I was like fully focused on that. And when COVID hit, obviously it was a very tough time for hospitals. It was a very tough time for healthcare, very tough time. And I know this now because I'm in healthcare and I hear the stories, and I speak to, my attendings, for example, that were in the hospital
Hmm.
during it. They were working like, like dogs. I mean, they were working
Wow.
hard. They were seeing a lot of death. They were from the anesthesia perspective, they were intubating almost 10 to 15 patients a day is what I was told. So it was very tough on healthcare. But me as a med student, when COVID hit, all of my in-person classes were made virtual. All of my practicals for, we had osteopathic manipulation practicals. That's kind of a DO thing. But all of that got canceled. We all essentially were made to stay home, just like everyone, right? For someone that's studying for their step one, That was a huge help, actually. It was
Oh.
actually from that perspective, it was a huge, huge help. Because I didn't have, kind of other responsibilities to deal with. I could now really focus on step one studying. So that helped a lot. Where it didn't help was getting an actual exam date, an exam seat at like a prometric was an absolute nightmare. Me and my buddy, who's now in an IR resident, interventional radiology. Me and him were like nonstop, just refreshing pages on the Prometric website to try and get a seat just to take our step one because all these seats were like gone. And the Prometric system isn't that great, really. And they would only release a very limited amount of seats. I think at one point I was scheduled to take the exam in like South Virginia. I lived in New York. So I was like 6 hours away from my test center. I would have to, and I was gonna go. I was gonna do it. I was gonna drive in the day before, like 6 hours, sleep there, take the exam, drive back, which sounds crazy, right? I mean, to drive 6 hours to take your exam, it's ridiculous. But we were
Yeah.
scheduled at a bunch of different places to try and make the most sense. At one point, I was like scheduled in Lancaster, PA, like Pennsylvania.
A little
Um,
closer.
yeah, a little bit closer, but
Still
still,
crazy, but
far. Yeah, yeah. Still, it's a little bit
yeah.
closer, but still, not like a train ride away or something. So it was definitely tough from that perspective. Eventually, closer to my exam date, they released a bunch of New York seats, and I was able to thankfully get one and take it in New York. But that made it really, really difficult. And then my kind of flowing into rotations, once I took my step one, at that point, then you're getting ready for your clerkships.
Mhm.
And it was kind of nerve-wracking because, we're going into the hospital and, I'm nervous. I don't like, COVID was still very scary at the time. Now a lot of people think COVID is, essentially, it's kind of like the flu. It makes you a little bit sick. The vaccines have changed a lot, et cetera, et cetera. Back then it was still like, people thought it was the kiss of death. So it was pretty nerve-wracking. Everyone was wearing an N95 basically at all times, or like double masking. So that made it really interesting to really think about that. We had that kind of like, that period in healthcare where everyone was like just super, super nervous. Like I said, the vaccines and I think just, the natural herd immunity that has happened for sure changed the perspective on COVID. But back then it was definitely interesting. In terms of how it's changed hospital life today, it's actually funny. I think it's almost like it never happened sometimes, it feels like. I mean, the only thing that you see that's a remnant of COVID is when people regularly wear masks just down the hallway, right? Um, you wouldn't see that before COVID. People wouldn't just wear masks kind of down the hallway unless you're like coming out of the OR, you're a surgeon, things like that, right? But you wouldn't wear a mask regularly if you're like an internist, right? Or if you're just someone that just runs the floor, for example. You're just not going to see that. But sometimes you'll see that, right? That's just kind of normal, commonplace life for us at this point, for everyone, right? Another thing is isolation rooms. If you have COVID, you'll go to an
Mhm.
isolation room. But I've had numerous amounts of people that are just like, yeah, I'm not really that concerned. I don't, it's our choice now if we want to wear an N95. It's not, strict hospital policy. At least for now, those things change all the time. But so it's kind of interesting to kind of see how the peak really was crazy and then it slowly decreased. And then lastly, how does it change the med school? I think is pretty similar to how you guys have it at Hunter. A
Mhm.
lot of classes are virtual. I think the things that can be virtual are virtual. The things that have to be in person are in person. I'm not too familiar with how, a lot of med students are doing it now because I'm a bit removed from it, but that is my general consensus when speaking to medical students.
I see. Yeah, that's interesting. I kind of expected that was the case for med school, but I was still curious because there is like a lot of practical stuff, right, that you have to do. Is that still is that returned to in person, like the I forgot what you call them, the
Practicals,
manipulations,
the
for
osteopathic
example,
manipulations. We
right?
call it OMM. Yep.
Uh-huh. Those are all like back to normal, I guess, right?
I believe
Because I
so.
don't
I
see
believe
how
so.
you could
Don't take my
sure,
absolute word
sure,
for it,
yeah.
but I
Yeah,
believe so.
I mean, yeah. So, we've been talking a lot about kind of the later stage stuff when it comes to like becoming a doctor and stuff like that. I kind of want to bring it back a little bit to, the pre-med sort of world. Um, a question that still relate to med school actually. Just because there's such a broad range of students that might be watching this, and by that I mean people that could be even like incoming freshmen to Hunter College, interested in pursuing medical school, rising sophomores, all the way to like people that are like on the verge of applying to or attending at this point maybe medical school. I was just wondering what you can it's as open-ended as you want it to be. Just what would you say about the kind of studying that one has to do? Like what should people that are maybe at each of those different transitioning steps, or maybe just like the high school to college and then college to med school step generally, what kind of things should they be aware of, whether they're going into Hunter College or going into med school? What should they expect? What are like some important things to understand, that sort of thing?
Sure. So great question. And my studying, I remember, changed a bunch as I go went from pre-med to med school to residency. And I'll kind of break it down like this. So when you start any new, I guess, kind of endeavor, it's always gonna be it's always gonna feel like you're drinking water from a fire hydrant or a fire hose. That's the classic saying that you hear in med school, right? And that will not really change for a while, unfortunately. It's not that it won't change for a while. Let me take that back. It's just that it comes back and then you figure it out again, and then it comes back and then you figure it out again. So when I started pre-med, when I was in undergrad, again, I told you that I was still a bit undecided. Interestingly, I wasn't even the best student before that. I was, not super interested in education. That changed in my later years. But when I started, I didn't really know what I was doing, right? I didn't know how to study for physics or organic chem or biology. I didn't really know how to go about it. But one thing that I always kept in mind was I want to treat this like my job, meaning I want to do this from Monday to Friday. Even if I finish my homework, my assignments, I want to get ahead. I want to treat this like my job so that I have my weekends off. That was the biggest thing. People, when I speak to pre-meds that I'm, either tutoring or mentoring, they ask me like, hey, like I'm studying like every day of the week, you know, I'm still not feeling like I'm doing that great. Like, what's the deal? And I tell them they're probably just a little bit burnt out because studying every single day, working every single day is just not something that anybody can do. Nobody does that. Okay. Um, so treat it like a job, Monday through Friday. You know what I mean? Just as soon as you get to, your first class, finish your class. I went to the library. That's where I did my best work. And I would kind of finish all of my work until like around, 7 or so, right? And then I would head home. Another tip I have for pre-meds is that you are going to be throughout your years going to be dealing with a lot of different classes like orgo, physics, biochem. On top of that, you're going to have to deal with your other, core courses. What I mean is like things like music history, statistics, philosophy, your language courses, things like that. So it can get tough to juggle it. So the biggest time management thing that I recommend to everyone is you want to have the only thing on your plate, you want it to be your pre-med courses. That's the most important thing for you for the MCAT, for your science GPA, etc. That's what you want, but it's not the only thing on your plate. So the best thing you can do is get the other things off of your plate. Finish your work for your other courses first. As soon as you get an assignment for your music history course, finish that. Just do it. Right? First things first, just go get that done so that the only thing you have to focus on is bio. You have a philosophy paper to write, just write that paper. Now the only thing you have left to do is physics. That really, really helps because when you're studying, at least for me, and I find for most people, when you're studying for physics and you have in the back of your mind, you have this philosophy paper to write, but you're still really trying to figure out this free body diagram. It can just be very taxing and difficult mentally. So I find that was the easiest way to do it. That's the kind of tip for I have for pre-meds. You don't need to study on the weekends if you have good time management skills. And I think those are the best skills that I would recommend. For the MCAT, I mean, hey, it's It's a standardized exam, super important exam for you to go to medical school. I recommend that people take it in January. Why? Because a lot of times people take it, you know, a second time. A lot of times I did, right? And so that leaves you with about 3 to 4 months before your application cycle opens in June, to retake it and get a score back. Uh,
I
but in
would
terms,
comment on that
yeah,
just so you know because it's not something that you would know about recently. For like committee letter applications and stuff like that, the deadline has been moved up to avoid the exact problem you just described.
yeah,
So now if we want to apply for committee letters at Hunter, we have to have a score in by I believe like October or something like that. So then when
yeah,
we go through the fall and so this is relevant for like people that have pre-health files open and they're, trying to do the committee letter process or committee packet process. That's also a thing now, that didn't probably exist, when you were here. But yeah, so yeah, even earlier is now suggested, but the point is very salient that you want to do it ahead of time to leave yourself room. That's kind of the whole idea about their change. And anyway, I don't want to interrupt too much longer.
sure, sure. No, no, that's a great point. That's good for anybody that's listening. And I mean, if you take the exam super late, you're just buying yourself, or at least you're risking an extra gap year that you don't need. And it's not, if you don't want to take that gap year, you might have to if you're not happy with your score. If you take it, let's say April, like your score, by the time you want to take it again, the application cycle already opened, it's unfavorable to apply late. Now you're taking an extra gap year. And so
Yeah.
that is, it can really get sticky. So I always recommend January. Um, MCAT studying, I mean, there's a million ways to do it. I tell people you want to dedicated at least 4 months, ideally six, of intense studying, and attack your weakest stuff early on. For me, it was like cars. You attack it early on, because if you're really good at science, you're gonna do pretty good on the science sections. You know what I mean? It's not the MCAT is not an exam. Some people think it is, but it's not an exam that is like impossible to take. If you're good at science, you will do fairly well in the science section once you get your feet wet. If you're not good at psych, you will not do well if you don't put time into psych. And so a lot of students end up just gravitating towards the things that they like the best and studying for that, and that kind of ends up biting them in the butt later on. So I recommend that. In terms of med school studying, so that's when it gets different. Really depends on how you like to study. That's when I became a flashcard person. I started to use Anki a lot, something that back in my day when I was at Hunter, most people had no idea what Anki was. Nowadays, everyone knows what it is. But Anki was huge for me in Anki, maybe I might be saying it wrong. But it was huge for me in medical school. And that's something that you have to kind of keep up with every single day. I would still make it a point to not study on the weekends other than my flashcards. I would just get that done. But very similar type of vibe as to how I did it when I was at Hunter. Treat it like a job, Monday through Friday. You're in the library from morning to, end of business hours. And then, on the weekends, I would kind of maintain it with my flashcards. Unless I had an exam coming up, then I would maybe take the weekend and try to get some extra studying in to do well in my exam. Um, and then, you know, moving on to residency, that's when you just have to study basically anytime you find time for yourself. Most residents end up studying closer to their exam, because you don't want to just keep studying all the time. Anytime you find the short time that you have to yourself, you want to just start studying. No, you're going to start studying a couple months ahead of your exam. And so all those stages that I just described are drinking water out of a fire hose or fire hydrant. All of them. As soon as you start them, it's every single time. It's gonna feel that way. But you just get used to that feeling. And so to anybody that's listening that is experiencing that feeling is not gonna it's gonna go away, but it's gonna come back eventually. And that's totally normal. That's to be expected. And you just have to keep drinking that water, and eventually you will pick it up. Everyone does. So don't feel like it's not cut out for you if you're feeling that anxiety of like, how am I supposed to handle all of this? But you will figure it out if you keep yourself in the game.
Yeah, I like that note to end that topic on, because yeah, it's just a series of trials, really. Like, you overcome the first, like, let's say learning how to study for like your first few classes at Hunter College, and then then you take like some upper level courses, and then okay, well, that's a little different. Like, you have to kind of
Right.
meet those demands, and then you have to meet the next demands, and then
Right.
it's like just the cycle of adaptation. And I just like that you emphasize that, if you could do it once, you could probably do it again,
Yep.
really, because
Yep.
it's just a matter of figuring it out. And it's going to be different for every person. Every person's going to require their own kind of strategy, more or less. I like that you mentioned Anki/Anki. It's one of my favorite things,
Yeah.
honestly. And there's a lot of other like evidence-based study techniques out there. So I mentioned that because for anyone that doesn't know, Anki is like a it's the kind of core principle of it is spaced repetition learning.
Right.
And if you look into that, that's been shown to be really effective in terms of like learning things over time, especially like remembering a lot of different pieces of content. And so as I understand it, you actually have your own kind of tutoring and mentoring company that you've started to
Yep.
sort of specifically address these kinds of things, as well as the overall journey of
Mhm.
pre-health students. I was thinking maybe you could elaborate a little bit more about that.
Sure. Sure. Yeah. So, as a bit of a, background, I was a tutor during my college years. Once I started to get into the groove of pre-med, I ended up becoming a peer TA and then a TA, and I tutored a lot. After that, when I had a gap year in between pre-med and medical school. I tutored during that year. When I got to med school, I was started tutoring, other med students as I progressed, and as well pre-meds. The reason I'm saying that is because I tutored for a very long time. So why is that a key thing? It's because I found that a lot of times when I was tutoring people, right, I wasn't just teaching them, regular things like, how does the nephron work, or how do I solve this organic chemistry problem, things like that. I was also providing them a lot of mentorship, like, hey, Simon, how do I get a good letter of recommendation? How do I, find research? How do I, get involved in volunteering? How much volunteering is good volunteering? How do I, do all of my interviews? So I was mentoring as well as tutoring, right? And so that's when I realized that, a lot of these students are exposed to a lot of people that can teach them chemistry, for example, but they're not, the people that are teaching them are not exactly versed in the pre-med path. You can find someone that's a PhD in chemistry that can teach you some chemistry, but they're not going to be able to tell you how to get, into medical school. And so I decided to start this company that basically offers tutoring and mentorship as a bundle. It's basically a form of a med student, for example, teaching a pre-med student, but this med student has just been through the works, knows all of the small ins and outs, and can help this pre-med student, kind of wiggle their way throughout this entire process without the standard generic advice that you would read online or things like that. And so I think that that has really kind of helped the students that we work with, because it's really like it's almost like insider tips. And so yeah, that's kind of been the journey. It's still, it's a very new company, but we've seen so much growth. And the students that we work with, they're doing great. So it's called SCATS Education. Not
I was
hard to
just
figure
about to
out.
ask, yeah,
Yeah.
scats
Oh yeah.
education.
Exactly. My name is Simon Katz. I ended up I decided to make a website one day, and I was just kind of, this was actually like, at the end of my fourth year of med school. You have a ton of time on your hands at that point. And so I was like, you know what, let me learn how to make a website just for, just for fun. And so I kind of looked at some tutorials online and just made a website. And I was like, but why don't I make a little tutoring website? I've been tutoring for a while. So what do I call it? I said, all right, my name is Simon. My last name is Katz. Just call it Scats Education. And so,
Sketchy.
yeah, why not? Right. And so I just kind of left it as that, and it's been growing and growing. And so a lot of, Hunter College students already know us because I work with Camille a bunch. But that's kind of the background as to how it got started and how it's going. And we're growing every single year, and it's been so much fun, to kind of give back and see how the college experience is different from back when I did it.
Yeah, I totally get that sentiment about how it's kind of nice to give back to kind of help, students who are kind of in the throes of it. Because I remember, I don't know if it was called the same thing when you were here, but I remember I went to this first seminar called the Everything You Need to Know About Being a Pre-Health Student seminar. I believe that's what it's called.
Yeah.
And I came into that not really knowing like what I was getting myself into. Like I've wanted to be a doctor since I was like about 14 years old, but I didn't know what I had to do during college. You know what I mean? Like
Yeah.
I didn't know really even all the classes I was supposed to take, let
Exactly.
alone all the extracurricular stuff, how to do this and that.
And that's exactly what we're trying to combat, because so many
Right.
students don't have the right guidance. And
Yeah.
I wish I had someone that, could tell me like, hey, this is how you get a good letter, and hey, this is how you find actual good research, and not just, some lab that you're probably just reaching out to, your professor. That is, an okay option, but there's plenty of other options out there that can help you, for example. So I wish I had some of that, mentorship, and that's, like I said, that's exactly what we're trying to combat.
So since you mentioned this, it's arguably one of the most, or rather one of the very important components, and like increasingly so, components of a pre-med's overall application. What their kind of research experience is. Like it's really good to have research, to have poster presentations done, to have uh, publications if you manage to get any. So I think maybe you would have some good advice given your experience, especially in like tutoring others and mentoring them, on how to kind of get those connections, those research connections.
Yeah, it's tough. It's definitely not easy, especially if you're coming out of a CUNY. You really start to feel that difference in terms of like, these big private institutions versus, kind of like a city college. There's not that many connections that you can form. So a lot of students I found, at least in my time, and still are reaching out to their professors that are obviously doing research because they have to for their PhDs and things like that. And what you find is that what I've learned over the years is that there's two types of research. There's clinical research, and then there's bench work. Okay. And clinical is the way that you want to go for multiple reasons. One, it's actually related to medical school and the field and the career that you want to pursue. Number two, clinical work is not something that you have to go in, to a lab for usually, right? A lot of times you can do it remote, right? Via Zoom meetings and things like that. And number three, and this is the most important, you can get a publication much quicker than bench work. Bench work takes a lot of time, a lot of effort. The quality of the publication from bench work is usually very significant if you can get that published. Okay. But clinical is much more savvy and can help you strengthen your application a whole lot more. That's why I always recommend, pre-meds to stick to clinical if they can. With that being said, how do you find that? So the best way to do it is to reach out to residency programs. Okay. The reason why is because all residents have a requirement for research that they need to do. Okay. You have a set quota that you need to get done throughout your years. And so there's always research opportunities there, especially if it's a true academic center. And so if you reach out to residency programs, a lot of times they will have opportunities. If they don't have opportunities, at that point, you can just start cold emailing a lot of physicians kind of on, Mount Sinai's page, Columbia's page, NYU's page, Cornell's page. They have the advantage that Hunter students in particular have is that they are in New York City. This is a huge metropolis of physicians that have tons of projects just laying around that they just haven't had a chance to finish, and they would love a motivated pre-med like yourselves, right, to help them. And so that's it. It's a super easy way to kind of to get some research. And then last but not least, I mean, once you get one, it's much easier to get the second, because all you have to do is once you finish up a project, say, hey, is there anything else that there's work on that I can work on? A lot of times they'll say no, but then you can ask, well, do you know of anybody else that has any work going on? And a lot of times that answer to that will be yes. And so it's like a snowball effect. And so that's what I really recommend. I think that, although bench work can yield some good results for your application and for your own personal development, I think that clinical is where you want to go to really get to the point that you want in terms of your med school application.
That's really interesting because honestly, I'm kind of farther along the pre-med path, and I never really considered that. So, even
Yeah.
yeah, that seems very
You
valuable.
only learn that later on in the years. I didn't know that.
Yeah,
Trust me, I didn't know
it
that.
makes sense too because even if someone wants to do an MD PhDs mostly do clinical research. I
Yep.
mean, I think entirely, if not mostly. But
Yep.
okay, that's really interesting. I
Yep.
have to say, you've given us a lot of great information today. I don't want to hold you too long because I know you're extremely busy. I want to thank you again for coming on. It's been a pleasure talking to you, Dr. Katz. I hope you have, a good rest of your weekend. Just yeah,
Appreciate it.
thanks again.
Thank you so much for having me. This is a ton of fun. I always love to kind of give back and talk about my journey and, hopefully it inspires someone out there. If anybody ever wants to reach out, you can check out my website, that's scatseducation.com, or just shoot me an email, ask Camille for my email. She has full reign to give out my email so we can chat. But otherwise it's been a great time. Thank you so much for a good conversation.
Thank you. All right. Have a good day, everyone. Hope you enjoyed the episode, and we'll see you next time.